Hello, this is Dr. Sunil Tumala. I am a practicing neurologist. I practice in Frisco, Texas. The time now is 9:18 p.m. Today is May 13, 2021. I have been asked a few important questions by various people, including friends, family, relatives, that pertains to COVID-19, which is causing significant confusion and anxiety. So today I decided to go over these two questions to help these folks. I hope these are the questions that other people are also having, and I hope I will answer and help them during this short video. Again, the goal of this video is purely for educational information purpose only. So use it as such. If you need an individual medical opinion, please consult your doctor. So with that disclaimer, let us get in. The first question I was asked is, when to get tested for COVID-19? The second question I was asked is, what to do if I have symptoms suggestive of COVID-19? So very important questions leading to a lot of confusion and unnecessary treatment, anxiety, and I'm hoping this will help you. So we'll go right away into So let's go here. So the first question, when to get tested? You get tested in two situations, only two situations. If you have symptoms suggestive of COVID-19, if you have symptoms suggestive of COVID-19, which includes a fever, cough, shortness of breath, or smell problems, decreased smell or absent smell. If you have any of these symptoms, please do go get tested for COVID-19. The second situation you need to get tested is if you have exposure to someone who has active COVID-19 infection still going on and you are in close proximity to that person without wearing a mask. So you are not wearing a mask and you're in close proximity, and that, or maybe in the same room or in the close proximity outdoors, and that person is having active COVID-19 infection. So in that situation also you need to get tested. So close proximity, no mask, exposure to infected person. Okay, if the person is infected and recovered, so the person is no longer infectious. So exposure to such person is not considered necessary indication for getting tested. Okay, so these are the two situations where you need to get tested, so that even if you have no symptoms in this second case, but you can get tested, I would recommend waiting at least 3 days from the exposure date before you get tested, because there are some cases where the test, if done within 24 hours or within 3 days after exposure, it may come out negative, but it may turn out positive later. So wait 3 days unless you have symptoms before you get tested. The second question, what to do if you have symptoms? If you have symptoms suggestive of COVID-19, as I said, which includes fever, cough, shortness of breath, smell, okay, so smell decrease. So if you have any of this, then you obviously get tested, and there are two possibilities. You have test positive, you have test negative. If you tested negative and you keep watching yourself because you have some exposure, and if you develop symptoms, then you go ahead and get tested again in around 3 days or so. But if you do not develop symptoms, then you're good to go. You don't need any further testing. So just watch out for any symptoms. Watch for any symptoms if you tested negative. But if you tested positive, then there are two possibilities. You may have asymptomatic infection, which per current statistics, there is a 40% chance of having asymptomatic infection, or there is maybe a symptomatic infection. You have some symptoms like fever, cough, shortness of breath, loss of sense of smell. If you have symptomatic infection, it may be mild to moderate symptoms or severe critical symptoms. If you have asymptomatic infection, that means you have no symptoms, but somehow you had an exposure and you got tested but no symptoms, you do not need to do anything except quarantine yourself, you wear a mask, don't spread the infection, and watch for the symptoms. If you do get symptoms, then go ahead and treat it accordingly as I am describing here. If you have mild to moderate symptoms, that means your oxygen is more than 94% and you are able to walk, let's say, few minutes without any difficulty, your fever is mild, cough is mild, you have some smell loss, you just need conservative treatment. If your fever is significant, take Tylenol. If you have cough, take some over-the-counter cough medication, hydrate yourself, quarantine yourself, wear mask if you are going into in close proximity to other people so that you don't spread the infection, and keep watching your oxygen and your symptoms. Oxygen, I would say, check at least 3 times a day. If you are not progressing or getting any worse, good. That means keep watching for at least maybe 10 days to 14 days and then you're good to go. That means you recovered with very minimal symptoms. However, if you become asymptomatic even before 2 weeks from the symptom onset or exposure, that means you became you recovered without any residual. If you do progress to severe symptoms, let us say you are watching for your symptoms, your fever is getting worse, cough is getting worse, and your shortness of breath is now happening where even with walking little distances, taking few steps, or you're short of breath, even sitting, and your oxygen level is below 94%. That means you are progressing towards severe and could develop critical illness. So you are the one who needs a aggressive intervention. So please go and consult the doctor, and potentially you need admission. So who are these patients who end up like this? Patients who have significant heart-lung conditions before COVID-19, who are undergoing some cancer therapy, bad diabetes going on, your sugars are more than 250, not well controlled, or you have underlying kidney or liver issue that it is not mild but at least significant degree. You have any blood cell disorders or immune deficiency disorders. So if you have any of these conditions, you are more likely to progress towards severe or critical illness. The other most important risk factors are also age. If you are more than 65 years of age, you are more likely to experience more symptomatic illness and could potentially go into severe illness if you have any other comorbidities which I just described. If you have high BMI, you have a higher weight, you can calculate your BMI with the height and weight. You can use your online calculator. If your BMI is high, if you are overweight, obese, then you are more likely to experience severe illness. So if you fall into this high risk category, then you need to look for this symptom progression. If you are relatively healthy, most likely you may recover. So the key here is not to put yourself in an anxiety position. If you start chasing treatment, somebody will give you antibiotics, antivirals, steroids, and you'll unnecessarily incur damage and unnecessarily incur side effects. You will destroy your good bacteria in the intestine, may end up getting colitis, which is essentially not necessary. If you have no symptoms, if you have mild to moderate symptoms, it is just conservative treatment with as needed fever, cough medication, and maybe some vitamins if you need. When to give steroids? If you have little bit of cough that is not going away with cough medication, simple cough medication, then I would say take prednisone 40 to 60 milligrams or equivalent dose of dexamethasone 4 to 6 milligrams for 3 to 5 days, not more than that. Taking it for a longer period of time can induce unnecessary fungal infections, and it can be deadly. So using steroids for longer duration for mild symptoms is not warranted. If you have no symptoms, no treatment necessary except following precautions, not spreading the infection, and keeping an eye on your oxygen. Okay, so that's our algorithm for those two questions. Hope this helps to prevent unnecessary anxiety, unnecessary treatments. Hope we'll come out of this pandemic pretty soon if we work together. One important thing, CDC today has issued a guideline saying whoever is vaccinated, fully vaccinated, no need to wear mask. I respectfully disagree with the CDC recommendation. I will still continue to wear the mask, and I would recommend everyone to keep wearing mask. That is the best protection we have until majority of the population becomes immune and until we know more and more about this virus. So especially if you are in high risk category, you have this comorbidities, that means you are more likely to experience severe or critical illness, then I would recommend you keep wearing mask even if you are fully vaccinated. Thank you very much. Dhanyavad. Stay safe.